Hello, this is Dr. David Green, CEO of the Georgia Pain Network. Today's topic is the basics of platelet rich plasma therapy. PRP therapy is a very exciting procedure. It uses one's own growth factors, platelets, and calls in stem cells to regenerate damaged tissue. Previously it's been used in dentistry, urology, ophthalmology, wound healing, and other fields. Recently it's entered into the musculoskeletal medicine realm. Actually, the definition is a volume of plasma that has a platelet count above the baseline of whole blood. Regenerative medicine breaks the mold of conventional treatments. Cortisone tends to work well, but it doesn't regenerate anything. It's a proverbial band-aid, whereas regenerative treatments help to heal and repair and regenerate the actual problem. The indications for PRP are extensive and include tennis and golfer's elbow, rotator cuff tears, rotator cuff tendonitis, Achilles tendonitis, knee tendonitis, hip, shoulder, and knee arthritis, along with any type of ligament injury, basically sports injuries in general. The outcomes for all of these have been shown to be excellent in small studies. Athletes are using PRP like crazy. If you look at the archives in Sports Illustrated and USA Today, you'll see Rafael Nadal, Tiger Woods, Kobe Bryant, several members of the Dodgers. Every week you hear about somebody else who's undergoing the treatment. With regard to how it's performed, it's actually a fairly simple procedure. It involves a simple blood draw like you get at any lab of 30 to 60 cc's of blood. The test tubes are then put into a centrifuge and spun around very rapidly for about 12 minutes or so. And then you get 3 layers that result. The middle layer is what you want. That's the platelet-rich plasma. That's extracted and then injected into the problem area. The 30-60 cc's you start with ends up going down to about 5 to 10 cc's for the actual injection. PRP therapy actually promotes inflammation, which is the first phase of healing. Therefore, anti-inflammatories should be stopped a week or so prior to the treatment. Professional sports leagues have not banned the use of PRP therapy. Initially, the World Anti-Doping Association did, but as of 2011, it is accepted because there's a lack of any current evidence concerning the use of these methods for purposes of performance enhancement. What are the outcomes? Clinical Journal of Sports Medicine study in 2013 looked at 22 patients for knee arthritis, and there was no change in arthritis in over 80% at 1 year with just 1 injection. Most people end up getting up to 2 to 3 injections, so this was just 1. Pain scores went down a lot. Functional and clinical scores increased at both 6 months and 1 year. Then there was a study out of South Florida looking at PRP for a tennis elbow in 30 patients. These patients were all ready for surgery. They tried everything. Over 90% of them were able to avoid the need for an operation with the PRP injections. More studies are needed to definitively prove the effectiveness of PRP and to figure out the best ways to standardize the treatment's preparation. We have standard treatment preparations now. We're just not sure if they're the optimal way to go. Now, with regards to the risk-benefit ratio, it's your own blood. It's an outpatient procedure. You do have increased pain usually for 48 hours because it does spark up inflammation. Then the pain relief starts to really kick in. It may take a series of 2 to 3 injections that are not currently covered by insurance. And studies are showing excellent outcomes with a very, very slight downside or a minor risk of infection. The top non-operative pain management in Georgia is through the Georgia Pain Network. There are over 10 clinics throughout the state accepting over 50 insurances and providing over 25 treatment options with the board-certified doctors. Visit us online at georgiapainnetwork.com and then call us for more information and scheduling at 404-850-9099. I'm Dr. David Green with the Georgia Pain Network. Your pain stops here.